Ghost posting reality. Healthcare facilities is posting openings to comply with healthcare regulations. So it's all ghost posting to make it look safe within the system. Meanwhile, registered nurses is sitting in the system working as personal support workers despite passing their boards, despite passing the NCLEX registered nurse exam. Hi guys, welcome back to my channel, and in this video we're going to be talking about the nursing shortage. Canada is facing an extreme registered nurse shortage, with experts believe that by 2030 they're going to be short of over 100,000 nurses. Facts and reality. Is that really the case? Is that really what's on the grounds of Canada? There's over 20 registered nurses in one facility that I know of, and this is facts, that is working as personal support workers that cannot find a registered nurse job. So if Canada is so short of nurses, why are there so many registered nurses working as personal support workers here in Canada? And this is the private sector. Don't talk about the government sector. There's also internal staff within the government sectors that is also working as personal support workers. And these are registered nurses that have already cleared the NCLEX exams, cannot get jobs as registered nurses. They are stuck in their facilities working as personal support workers. There's new grads, registered nurses here in Canada that cannot find registered nurse positions, or that cannot find jobs as registered nurses. And I'm sure the world could see Ontario right now is laying off registered nurses. Why are the employers in Canada ghost posting positions? Is it just to bring in personal support workers? Because Canada has got an aging population, hence the need more personal support workers than they do registered nurses. So is these ghost posting just to bring in registered nurses with the promise that after passing your nursing NCLEX or clearing your nursing boards in Canada as an internationally educated nurse, you would be transitioned onto an RN position? Is that a way of hiring personal support workers? Because from what I'm seeing here in Canada, even after you pass your boards, even after you pass your NCLEX exams, you cannot find a job here as a registered nurse. You will be sitting there for months and years working as personal support workers. And as we all know, as registered nurses, you have a certain time within the system. The wider your gap gets within your practice, it's more difficult for you to find a job as a registered nurse, because nobody is going to hire you with no experience. And here in Canada, another thing is that they need you to have Canadian experience before they can hire you. And after you pass NCLEX, you're still not able to get a job, because some of the facilities that brings you into the province or into the country don't have, because they have brought in too many personal support workers and promised them that they will get their RN position once they have passed NCLEX exam and there's available position there. They don't have the capacity for the amount of RNs that they have brought in. There's a lot of registered nurses in Canada, and this is Newfoundland to be exact. There's a lot of registered nurses working here as personal support workers that cannot find RN positions, yet still they're saying they're very short of registered nurses. It's ghost posting. They would post these jobs, you will apply, you will tailor your CV to suit the job description, you will do all what they say, and yet still you will get no response. You would just see that your application is just sitting there. Nobody's looking at it. Okay, so my advice for internationally educated nurses who are still outside of Canada that is planning to come to Canada, please before coming to Canada, either do your LPN license if you're able to, or your RN license before coming to Canada, and try and secure yourself an RN position or an LPN position before coming into Canada. Because I can tell you right now, once you get into Canada as a personal support worker, it is more difficult. After you pass your NCLEX, it is more difficult for you to transition onto an RN position. It is not as easy as some social media pages make it sound. This is facts. I'm giving you guys facts. Whatever I put and you see, whatever I bring to my channel is facts. Okay? Sometimes I may have videos about myself and doing certain things, and but whatever I come to talk here about nursing, it's facts. Okay? I don't joke with my profession. I have been a nurse now for over 20 plus years. And I can tell you, what I'm seeing here in Canada, there is no shortage of nursing here in Canada. It's all ghost posting. Because if even the rural communities that they're telling you that, because some people want to be in the city and some people don't want to be in the rural communities and some people just want to be, that's not true. Even the rural communities right now, you apply to the rural communities right now, you get no response. Ganda, Grand Falls, Corner Brook, and I can name a few others. You would apply with no response, and yet still you would go on the website and you would see so many job posted sitting there from since 2024, and they will tell you these positions will be filled when they get enough applicants. Now, in the government sector, there is also RNs sitting internally that is not being transitioned onto RN positions. So if they cannot transition the internal RNs within the government sector, if they cannot transition them from PSWs to registered nurses, do you think us external applicants stand a chance? What chance is there for us? It's a very slim chance. Because why? They don't have RN positions here. Right now, in some province, they are laying off nurses. Ontario is one of them. Okay? They are laying off registered nurses. They are more lenient on LPNs, which is licensed practical nurses, and personal support workers, because those are the professions that they need in Canada. Registered nurses is not short in Canada. They do not need as much registered nurses as they are bringing in. They don't have the facility to facilitate the amount of registered nurses that they're bringing into Canada. I don't know if they bring us in hope that some of us will not pass NCLEX, so we will remain as personal support workers, and they don't expect us to come in and pass NCLEX. Hence, they are bringing us in with ghost posting that they are so short of nurses. It's not facts. On the grounds, being on the ground here in Canada and experiencing the shortage or experiencing the difficulties in finding a job here in Canada, the real truth comes alive. Okay, there is no shortage here in Canada for registered nurses. So my advice for any internationally educated nurse that is planning to come to Canada, get a job as an RN or as an LPN before coming in. Do not come in as a personal support worker, because if you come in as a personal support worker, it's very difficult for you to transition onto an RN position. And after a certain amount of time outside of your profession, it's very difficult with that gap in your practice to even move forward. Okay, I think here in Canada, after 5 years, you have to go back and do some sort of a bridging course before you can get back into practice. So be wise and know what you're doing. I don't know what is causing the delay in hiring, if it's a budget deficit or if they're really, really not short of nurses as they're saying. But there must be some reason why they're not hiring. registered nurses. And this is not just internationally educated nurses. This is nurses that is actually based here in Canada as well. This is newly qualified nurses, even new grads that is coming out of university right now cannot find nursing jobs here in Canada. It's very difficult. And yet still they're saying that they're going to be so short of registered nurses, right? By 2030, they're going to be short of over 100,000 nurses. That is not facts, because the reality is there to show. The figures is there to show. If they're to do a survey in the public sector and the government sectors, the amount of registered nurses that have already cleared the NCLEX exam and sitting in these sectors would show that the figure that they're putting out here is wrong, very much wrong. And I find it very misleading for some of us, and it's actually deceiving, because it's like they're actually feeding you false information. It's false hope, because you come into Canada with the hope that, okay, I clear my NCLEX, or after I pass my NCLEX, I would easily be transitioned onto an RN position, or there would be, jobs that I can apply for an RN position elsewhere if my facility cannot facilitate me. That is not the case. Okay, so be wise, be aware, and don't just jump into Canada as a personal support worker, because you will find yourself stuck in that situation and cannot transition. All right, thanks for watching, and I'll see you guys in my next video.